Every October is a breast cancer awareness month. It's not even a day or a week. That's how important this disease. So we are here to remind all women to be aware of that disease. In 2020, there were 2.3 million women diagnosed with breast cancer and 685,000 deaths globally. It is the world's most preventable cancer. Yes, it can be prevented and can be diagnosed early and treated. Breast cancer is not a transmissible or infectious disease, unlike some other cancers that have infection-related causes, such as the HPV, the human papillomavirus, and cervical cancer. Also, we have the H. pylori in relation to the stomach gastric cancer. Approximately half of breast cancers develop in women who have no identifiable breast cancer risk factors, other than gender, to be a female, and elder age, which is 40 and above. Certain factors increase the risk of breast cancer include the following factors. Age, elder will be more at risk. Obesity, more weight will be more at risk. Harmful use of alcohol, family history of breast cancer, a history of radiation exposure, and the reproductive history, such as age at the menstrual periods begun and age at first pregnancy. Tobacco use is also one of the very bad risk factors, and the postmenopausal hormone therapy. The behavioral choices and related interventions that reduce the risk of breast cancer by 30% include the following, which we advise to do so. Number one, prolonged breastfeeding, regular physical activity, weight control, avoidance of harmful use of alcohol, avoidance of exposure to the tobacco smoke, and avoidance of prolonged use of hormones, and avoidance of excessive radiation exposure. Yes, we need to be aware of all of that to be more protective. Okay, by the way, it is good to know that approximately 0.5 to 1% of breast cancers occur in men. The treatment of breast cancer in men follows the same principle of management for the woman, and it is very aggressive in men, so I need to be careful as well. The good thing is the screening, which is a very important preventive tool, and it is the most important tool of this prevention. We do have self-breast examination, which is not very reliable, but still advisable for women to do so, to be familiar with their breast and to report any changes in terms of the look or in terms of the touch. We have also the ultrasound and mammogram. For the ultrasound, it is better than mammogram and the mammograph for women younger than 40 years of old. That's why women age 40 and above, 40 to 44, should have the choice of annual breast cancer screening with the mammogram, which is an X-ray to the breast, if they wish to do so. While women age 45 to 54 should get mammogram every year. And the woman 55 and older should switch to mammograms every 2 years or can continue the yearly screening. By the way, lab and animal studies suggest that probiotics may slow the growth of the breast cancer cells, even though more studies are necessary to prove that. What they mean, if we have a dysbiosis, irregulation of the numbers, and also the tax of the probiotics, that will affect our bodies and the woman body. So it is important to have all these good distribution of probiotics, and also to have a good sleep, good water intake, some exercise in order to avoid that disease. And here, we wish all the women best of health and longevity.